Good morning, everyone. My name is Pedro Rivera, and we're going to be talking about certification for nurses. We're going to be focusing on the CCRN certification for critical care nurses. A certification, let's start with that. It's a continued professional development that is going to improve your skills and knowledge. We're going to keep those skills up to date. There's a bunch of nursing certifications. We're going to be talking about the CCRN, but there's like more than 20 certifications that you can go and check it out depending on what you feel it's better for you. We have the critical care nurses, we have the oncology certification, we have the emergency certification, we have the MedSurg certification, and much more. The healthcare professionals need to update their skills regularly and continue their education for professional development. To succeed in providing comprehensive care for the patients, nurses need to utilize the best evidence available to them. It requires for them to use different ways of learning, which include certifications. They need to approach in different ways to acquire that knowledge. It could be through certifications, like I said before. It could be through formal learning, like courses, workshops, or informal learning through your job. Now the CCR certification, it's like I said before, is specialized for critical care settings. It could be a nurse that is already working on the ICU and wants to improve their skills, or it can be for a nurse that wants to migrate to the critical ill patient status and they want to gain more knowledge, for more confidence, and getting new skills. It provides the opportunity for career advancement. Like I say, you can migrate from one unit to the other one, or you can just go to be from a regular nurse to a supervisor to a manager to a leader that will just help and improve your unit and hospital. Now, the requirements for this certification is like you need to have an unencumbered RN license in the United States, and you need to meet one of these two requirements for hours. So either you practice as an RN or APRN for 1,750 hours of direct care, in which almost 900 of those hours must be from the most recent years before your application. The other option is to practice as an RN with at least 5 years of experience and a minimum of 2,000 hours in direct care, in which 144 hours must be from the most recent years before your application. And you also need to pay a fee. If you're part of the American Association of Critical Nurses, then you pay $250. If not, then you pay $365. The hours that you need for this certification must be completed in the United States based facility or in a facility determined to be compatible with the United States standards for acute or critical care nursing practice. Those spent actively providing direct care to acutely critical ill adult patients or supervising nurses or nursing students at the bedside of acutely critical ill adult patients, if working as a manager, educator, preceptor, or APR. The majority of practice hours for the exam eligible must be focused on critical ill patients. Now, these hours need to be verified. And for that, they're going to use either your supervisor or any professional college with the qualifications to provide verification for those clinical hours. Now, all the certifications have the benefits. Now, like I said, we're going to focus on the CCRN, and this is going to provide us self-validation. What does it mean? We're going to improve our knowledge, improve our skills, get more experience, and get this clinical judgment that is going to help us to make those difficult decisions. It's going to show that we are committed to improve as a professional and develop our career. It provides patients and their family with validation. It's not the same for the patient to have a resident nurse that they just graduate from school and they're just getting their first years of experience, and having a certified nurse that has their years of experience already and they have improved their skills to promote that care for those patients. It will benefit your job. I mean, the more professionals, the more certifications they have in their hospital, the more benefits they're going to have. They're going to have all these patients because at the end of the day, there's a lot of patients that they look for the best treatment. So if they hear that this hospital have this X amount of nurses that are certified, that are specialized in critical care service, then they will go there to get that service. It is a voluntary process to get this certification of specialization, but it shows that it's a commitment to the career development and dedication to patient care. Today's acutely and critically ill patients require highly vigilant and extraordinarily intricate care from a team of highly skilled health professionals. Nurses confirm that patients admitted to their units are sicker than ever before. So years ago, many of these patients will not have survived long enough to be in the hospital. As healthcare has become more complex, it has become increasingly vital to ensure the public that healthcare professionals are competent. And the only way to do it is to get certification. This is the way to provide them with that reassurance. Everyone in the healthcare equation, patients, employers, and nurses benefit from certifications as a mark of excellence. 3 in 4 said that given a choice, they are more likely to select a hospital that employs a high percentage of nurses with specialty certifications. And this is from patients, like I was telling before. If you tell the patients that you have a group of nurses that are certified in a specific topic, they will likely to go there because they want professionals. They want the quality in skills and knowledge. Now, how this is going to help your communication? There's going to be better knowledge. You're going to be able to communicate better with the patient and with the providers. There's going to be better treatment. You're going to have better understanding how the treatment works so you can actually apply that knowledge when you're doing the treatment to the patient. And it's going to improve the quality of care to the patient itself. Within your healthcare team, there's a good communication. It's going to foster a culture of transparency, respect, and collaboration. It involves coordinating with the doctor, nurse practitioners, physician, assistant, and other healthcare professionals. By you communicating in the right way, you're going to enhance the team's ability to make informed decisions that will lead to better treatments, reduce medical errors, and optimize the patient outcomes. Being articulated and a good listener in multidisciplinary meetings is going to enhance your contribution to the team in solving problems. Okay? So such smooth team dynamics can greatly reduce workplace stress and improve the overall quality of care provided to these patients. Leadership is going to improve quality. You're going to be able to make and support changes in your unit and in the hospital. And of course, lead by example. You're going to be that to-go person when someone needs a piece of knowledge, when they're unsure of what they're doing, and you can explain them and lead them so they can learn how to do things the right way for the benefit of the patient. To achieve a sustainable change, quality improvement initiative must become the new way of working rather than something added to the routine clinical care. The more knowledge will make you a better leader. And the company and of organization, they cannot go through changes without support of their leaders. And the role of the leader is crucial for change management. Leaders need to be able to commit to the change, and they need to be able to communicate this change to the community and to the rest of the organization. The knowledge you acquire after a certification will give you a clear and powerful vision that provides a sense of direction and purpose. As a conclusion, we have seen that the certifications, in this case the CCRN, And most of them are going to provide you with the same thing. You're going to gain new knowledge, improve your skills, get better job opportunities, and improve your um, care for the patient. There's no contraindication for any certification. There's only benefits here. Okay, so review your certifications, check which one is the best choice for you depending on what approach you want to go from here on in your nursing career. If you want to stay as an emergency room, then get the emergency room. Plus, you can get a trauma certification too, since you're going to see that a lot in the emergency room. Also, if you're working in an oncology hospital, you can get your oncology certification with a critical care certification. Most of these oncology patients are always really, really sick. So a critical care certification will actually improve the care that you can provide to these patients. Okay? So just think about it, review them, and choose the best for you. Have a good day.